Good morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the classifications of bone. So first classification is according to shape. First is the long bone. Each long bone has an elongated shaft which is known as diaphysis and two expanded end which is known as epiphysis, which are smooth and articular. Articular means which are involved in the joint. The shaft or the diaphysis typically have three surfaces separated by three borders, a central medullary cavity and a nutrient foramen directly away from growing ends. For example, typical long bone examples are humerus, radius, ulna, femur. Miniature long bones only one epiphysis are metacarpus, metatarsus and phalanges. And modified long bones having no medullary cavity, that is clavicle. This is a typical example of the long bone which have two ends, which is known as epiphysis, and which in between them is a diaphysis, which is known as the shaft. These are example of the metacarpus are the example of the long bones. Next are the long bone example is a clavicle which have no medullary cavity. Next are the short bones. Their shape is usually cuboid, cuneiform, trapezoid or scaphoid. For example, tarsals and carpus bones in foot and hand respectively. Flat bones. It resembles shallow plates and form boundaries of certain body cavities. For example, bones in the vault of skull, ribs, sternum and scapula. These are the carpals, which are the examples of the small bones. These are the flat bones. First are the ribs, second is the scapula. Fourth are the irregular bones. Irregular bones when there is no particular shape of these bones. For example, vertebra, hip bone, bone in the base of the skull. Fifth is a pneumatic bone. It is a certain irregular bone contains larger air spaces lined by epithelia. For example, maxilla, sphenoid, ethmoid, etc. They make the skull light in weight, help in resonance of voice, and act as air conditioning chamber for the inspired air. These are example of the irregular bone. It is the first is the C1, which is atlas. Second is the second cervical vertebra, that is axis. This is example of the pneumatic bone, that is ethmoid. Next are the sesamoid bones. These are bony nodules found embedded in the tendons or ligament or joint capsules. They have no periosteum and ossify after birth. They are related to an articular or non-articular bony surfaces. The surfaces of the contact are covered with hyaline cartilage and lubricated by the bursa or synovial membrane. This is an example of the sesamoid, that is patella, which is present in the knee joint. Next are the example of the sesamoid are patella, pisiform and fibula. Function are to resist pressure, to minimize friction, to alter the direction of pull of the muscles, to maintain local circulation. Next, seventh is the accessory or supernumerary bones. They are not always present. They may occur as ununited epiphyses developed from extra centers of ossification. For example, suture bones, OS trigonum, that is lateral tubercle of talus, OS basilanum, that is tuberosity of the fifth metatarsal, etc. In medical legal practice, accessory bones may be mistaken for fracture. However, they are often bilateral and have smooth surfaces without any callus. Last are the heterotropic bones. These are the bones sometimes develops in the soft tissue. Horse-rider develops bone in the adductors muscles, which is also known as rider's bone. Thank you.